Thank you to each and every one of you for being here with us today. We are very pleased to be able to welcome our beloved audience to our training program. Before we get started, I would like to express my sincere appreciation to all of you here today with us in our training program. Well, I don't want to take too much time, so a very warm welcome to each and every one of you to our training program on COVID-19 and its impact on mental health. If you have any questions, suggestions, clarifications, or just want to say hi, be free to do so.
Hi. Before we begin, we must all be aware of and understand the so-called COVID-19 virus. The first COVID-19 case was reported on the 31st of December 2019 in Wuhan, China, marking nearly 3 years of living with the virus. COVID-19 is a virus-borne disease caused by SARS-CoV-2. It is very contagious and has rapidly spread around the world. COVID-19 most frequently develops respiratory symptoms that resemble a cold, flu, or pneumonia. COVID-19, on the other hand, may affect more than just your lungs and respiratory system. It may also involve different sections of your body. It belongs to the coronavirus family, which contains common viruses that cause anything from head or chest colds to more severe but rare diseases like SARS and the Middle East Respiratory Syndrome (MERS). Like many other respiratory viruses, coronaviruses spread swiftly through droplets that are expelled from the mouth or nose when breathing, coughing, sneezing, or talking. The term corona alludes to the crown-like look that the coronavirus have due to the spike proteins that protrude from them. The spike proteins are critical to the virus biology. The spike protein is the component of the virus that connects to a human cell to infect it, allowing the virus to replicate within the cell and spread to adjacent cells. By targeting these spike proteins, some antibodies can safeguard you from SARS-CoV-2. The majority of those infected with the virus will have mild to severe respiratory sickness and recover without any special treatment. Some, though, will become very ill and require medical attention. SARS-CoV-2 spread quickly from person to person, yet it was initially thought that SARS-CoV-2 is transmitted from animal to human through direct contact with an intermediary host. Intake of infected, raw or semi-cooked meat may also result in virus transmission. COVID-19 is a zoonotic illness which an animal virus mutates to infect and proliferate inside the human body, rapidly spreading throughout the human population. People older or have underlying medical illnesses such as cardiovascular disease, diabetes, chronic lung disease, or cancer are more likely to develop severe conditions. However, anyone can become highly ill or succumb to the COVID-19 virus.
Hi, I will explain about the impact of COVID-19 that affect mental health for students, adults, and good citizens. To date, the major psychological impact on public mental health has been increased level of stress or worry. However, if additional restrictions and consequences are implemented, particularly quarantine and its effect on many people's typical activities, routine, levels of loneliness, sadness, destructive alcohol and drug use, and self-harm or suicide behavior are predicted to grow. For students, although there has been an increase in awareness of mental health issues as a result of COVID-19, most are more focused on adults and employees. However, it should be noted that mental health issues are not discriminatory like adults. Young people, especially students, are also severely affected both mentally and emotionally by the pandemic. According to the figures released by the police, a total of 872 teenagers aged 15 to 18 had committed suicide from January 2019 until May 2021. This was 51% of the total 1,708 suicide cases at that time. This figure can be linked to the results of a study conducted by the universities of Malaya. There was a consistent increase in depressive, anxious, and stress symptoms reported by 1,100 and 63 respondents over the 4 Movement Control Order, which is MCO, implemented. There are several causes of mental health among students. First, emotional deterioration due to lack of social relationship due to school closure. School is an important phase in person growth and not just in terms of academics alone. At school, children or students form friendship and support system that serve as stepping stone for them to meet social emotional needs. However, as a result of the transition of the learning system to the virtual world due to COVID, their social interaction were disrupted. Second, survive with open and distant learning, which is ODL. Online learning has also eroded the boundary line between personal time and schooling. Many students face high levels of anxiety because they have various school assignments that need to be completed. Coupled with long period of looking at computer screens, this has disrupted their daily routine and bedtimes. For adults, during the pandemic, about 4 in 10 adults in US have reported symptoms of anxiety or depressive disorder, a share that has been largest consistent, up from 1 in 10 adults who reported these symptoms from January to June 2019 in Figure 1. A KFF health tracking poll from July 2020 also found that many adults are reporting specific negative impacts on their mental health and well-being, such as difficulty sleeping 36% or eating 32%, increases in alcohol consumption or substance use 12%, and worsening chronic condition 12% due to worry and stress over the coronavirus. As the pandemic wears on going and necessary public health measures expose many people to experience situations linked to poor mental health outcomes such as isolation and job loss. In January 2021, 41% of adults reported symptoms of anxiety and depressive disorder in Figure 2. In a survey of June 2020, 13% of adults reported new or increases substance use due to coronavirus-related stress, and 11% of adults reported the suicide in the past 30 days. Suicide rates have long been on the rise, and many worsened due to the pandemic. Early 2020, the data show that drug overdose deaths were particularly pronounced from March to May 2020, coinciding with the start of pandemic-related lockdown. Throughout the pandemic, many people across the country have experienced job or income loss, which have generally affected their mental health. Adults experiencing household job loss during the pandemic have consistently reported higher rates of symptoms of anxiety and depressive disorder compared to adults not experiencing household job loss, which is 53% versus 32%, respectively in Figure 4. Similarly, findings from the December KFF health tracking poll show that households experiencing income or job loss are significantly more likely to report that worry or stress over the coronavirus outbreak has negatively impacted their mental health. Last is good citizens. Older adults, those aged 60 or above, make important contributions to society as family members, volunteers, and as active participants in the workforce. While most have a good mental health, many older adults at risk of developing mental disorders, neurological disorder, or sustained use problems, as well as other health conditions such as diabetes, hearing loss, and osteoarthritis. Covid-19 is a global issue proving to be very cruel disease not only because of its pathophysiology but has the potential to increase level of loneliness among the elderly. Loneliness can stem from lack of interactions since the 18th studies have shown that loneliness have a negative impact on mental health. In fact, it also affects the physical and social health of individuals as well as lowers the cognitive function of the elderly. What's more worrying, untreated loneliness can degrade the well-being quality of life of seniors until they have suicide thoughts. The study also found that seniors living alone experience high level of loneliness with moderate to high level of depression and anxiety symptoms. Quarantine at home is beneficial to maintain safety and reduce the spread of endemic, but it has a negative impact on the elderly when physical activity is reduced, as well as leading to decline in physical well-being.
So, what is mental health actually? Mental health is a positive concept that refers to people's and community social and emotional well-being. The concept refers to having enjoyment in life, being able to cope with stress and sadness, realizing one's potential and feeling connected to others. Mental health is not only the absence of a mental health disorder, it is about wellness rather than illness. How we think, feel, and act is strongly influenced by our mental health. It also has an impact on our physical well-being. Work, in fact, is one of the best things we can do to protect our mental health, but it may also harm it. Mental health is something that everyone should prioritize since it's linked to physical and social health, as well as having personal time for yourself, which is necessary for productivity and learning, and it's compact but adaptable. Mental illness, also called mental health disorder, refers to a wide range of mental health condition disorder that affect your mood, thinking, and behavior. Examples of mental illness include depression, anxiety disorder, schizophrenia, eating disorder, and addictive behaviors. Many people have mental health concern from time to time, but a mental health concern becomes a mental illness when ongoing signs and symptoms cause frequent stress and affect your ability to function. A mental illness can make you miserable and can cause problems in your daily life, such as at school or work or in relationships. In most cases, symptoms can be managed with a combination of medication and talk therapy. So, the symptoms of mental illness: feeling sad for a long time, sometimes for no apparent reason, numb or do not care about the environment, feeling significantly tired, lacking energy, and having trouble sleeping, often angry, excessively and very sensitive, feeling hopeless and helpless, often feel confused, worried, or afraid, had an unforgettable bad experience, experiencing delusions, paranoia or hallucinations, finding it difficult to concentrate, feeling excessively afraid or worried or haunted by feeling of guilt, drastic mood swings, tend to withdraw from the social environment, unable to cope with stress or everyday problems, and having suicidal thoughts.
There are many ways to find solution to our impacted mental health during the COVID-19 pandemic. During the COVID-19 pandemic, we have may experience stress, anxiety, fear, sadness, and loneliness. And mental health disorders, including anxiety and depression, can worsen. Surveys show a major increase in the number of US adults who report symptoms of stress, anxiety, depression, and insomnia during the pandemic compared with surveys before the pandemic. Some people have increased their use of alcohol and drugs thinking that can help them cope with their fears about the pandemic. In reality, using these substances can worsen anxiety and depression. That's because this addiction can harm lung function and weaken the immune, causing chronic diseases such as heart disease. For all of these reasons, it is important to learn self-care strategies and get the care we need to help yourself cope with COVID-19 pandemic. Firstly, we should take care of our body, always be mindful about our mental health. We should get enough sleep, go to bed and get up at the same times each day. We can stick close to your typical sleep-wake schedule even if you are staying at home. We can also participate in regular physical activity from online platform. Regular physical activities and exercise can help reduce anxiety and improve mood. Finding an activity that includes movement such as dance or exercise apps improve the condition of our mental health. Next, we should eat a healthy diet. We should avoid loading up on junk food and refined sugar. Limited caffeine as it can aggravate stress, anxiety, and sleep problems. Avoiding tobacco, alcohol, and drugs helps to improve our mental health. If you smoke tobacco or if you vape, you are already at a higher risk of lungs disease. Because COVID-19 affects the lungs, your risk increases even more. Next, we should limit screen time. Turn off electronic devices for some time each day, including 30 to 60 minutes before bedtime. Make a conscious effort to spend less time in front of a screen such as television, tablet, computer, and phone, although we are working and studying online. We can also relax and recharge to cure our mental state. Set aside time for yourself. Even a few minutes of quiet time can be refreshing to help settle your mind and reduce anxiety. Many people benefit from practices such as deep breathing and Tai Chi. Keeping your regular routine helps. Maintaining a regular daily schedule is important to your mental health. In addition to sticking to a regular bedtime routine, keeps consistent times for meal, bathing and getting dressed, work or study schedules, and exercise. Limit exposure to news media. Constant news about COVID-19 from all types of media can heighten fears about the disease and worsen your mental health. Staying busy during COVID-19 also helps. Healthy distraction can get you away from the cycle of negative thoughts that feed anxiety and depression. Finally, we should only focus on positive thoughts. Choose to focus on the positive things in your life instead of dwelling on how bad you feel during the COVID-19 pandemic. Consider starting each day by listing things you are thankful for. Maintain a sense of hope, work to accept changes as they occur, and try to keep problems in perspective.
Next, let's move to the self-treatments of mental health. So, there are 5 methods that we can use in this treatment. Let's begin with the first method, which is talk to someone. Talk to someone you trust, whether a friend, a family member, or a colleague that can help you. You may feel better if you are able to openly share what are you going through with someone who cares about you. If you live in an area where face-to-face interactions are limited, you can still stay connected with a loved one through a video call, phone call, or messaging app. Next, for physical health method. It is important to look after your physical health so that it can help you to improve your health and well-being. For example, be active for at least 30 minutes daily, whether that is running, walking, yoga, dancing, cycling, or even a gardening. And plus, you need to make sure to have a proper balanced meals and enough sleep. For the third method is to do activities that you enjoy. Meaning that you can try to continue what activities that you find meaningful and enjoyable, such as cooking for yourself or your loved one, playing with your pet, walking in the park, reading a book, or watching a film or TV series. So, having a regular routine with activities that make you feel happy will help you to maintain good mental health. For fourth method is to stay away from harmful substances. Don't use harmful substances such as drugs or alcohol to cope with what you are feeling. We all know that this may help you to feel better in short term, but that can make you feel worse in long term. So, these substances are also dangerous and can put you and those around you at risk of disease or injuries. For method number 5 is to focus on the world around you. By doing that, it helps you to free yourself by reconnecting with surrounding environment. For example, simply take 3 slow deep breaths, feel your feet grounded on the floor to make yourself feel more relaxed from stress. Lastly, seek for professional help method. If you feel like you cannot cope with the stress that you are facing, seek for a professional help by calling your local mental health helpline or getting in touch with your counselor or doctor. Remember, you are not alone and there are things you can do to support your emotional well-being.